So we are now recording. So I am going to, oh, we have someone coming in the waiting room. Okay. We are going to start with just a review of what is PBIS. We had an introduction to PBIS, and some of you might have been on that training. It's normally the first family training group that we have in the series. And this is kind of like a follow-up to that. So I'm just going to do a general review because it's important to kind of have some of that background knowledge about what is PBIS and how can that help us with navigating challenging behavior with our young kids. So PBIS stands for Positive Behavior Intervention and Supports. So it's, in general, it is a positive approach to behavioral interventions. So what does this mean in preschool? Some of you might have school-age kids as well, and school-wide PBIS is pretty big, right? But PBIS in preschool is becoming more popular, and it is something that we adopted here at Easter Seals in all of our divisions in Southeastern Pennsylvania. So we start by creating program-wide expectations. So here at Delco, it's be safe, be kind, have fun. Okay, so they're kind of like the general values we want our children and our staff to kind of uphold. We use a common positive language. We focus on telling kids what to do instead of what not to do. And we try to use common words and phrases in the building so kids learn those general directions. So an example would be, we say, use your walking feet instead of don't run. Okay, we say, oh, use a quiet voice instead of stop yelling. And instead of saying like, don't hit or no hitting, we might say, oh, keep your hands to yourself. Okay, so it's just one way to give a child an expectation and tell them what exactly to do. We can use these terms for if we have to redirect a child as well. And it's really helpful. An example of why we wouldn't want to just focus on the challenging behavior would be like if we say, no running, child might skip, crawl, who knows, tumble down the hallway, right? But if we say, oh, we're going to use our walking feet in the hallway, and it gives them like, oh, that positive example of what the expected behavior looks like, okay? We also don't want to overuse the no's, stops, and don'ts. Right? Like it's really important for a child to learn the direction of stop, right? Because, in case of an emergency, we want to say to stop and the child to follow that command, right? But if all we do all day is say, no, stop, 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 it kind of loses the power that it has, right? So we want to reserve those stops for emergencies where a child might be, endangering themselves or somebody else. Another piece of PBIS in preschool includes using visual sports and schedules. So we have a lot of visuals in our building and in our classrooms for the expectations, right? For what we talked about. If we're saying walking feet, we might have a little picture, like a little character using walking feet, right? But also for schedules. Visual schedules can be really, really helpful to help organize a child's day. Kids thrive within routine, right? So knowing what is coming, what's expected throughout the day can be really helpful. It can also be helpful to help them organize when there's a change in routine, right? Planning for that special event, talking to them about, oh, we're gonna, go to the gross motor room today instead of outside at the playground, right? And preparing them for those changes in the schedule can also be, it can be easier if you have the visual to help kind of describe what's upcoming. And then a focus on social and emotional skills and development, right? Things like friendship skills and problem solving, how to cope. Right? These are all social emotional skills that we teach within the PBIS framework in preschool as well. And then we also have professional development. We provide staff training in the area of PBIS. We have our our family groups and training supports. And we also have teams. We have a core leadership team for PBIS in our building that meets once or twice a month. And we're always looking for parents to join us. So if you have any interest in joining us, you could join us remotely or in person if you'd like. But we meet after the kids leave. And yeah, we talk about different initiatives and different practices as it relates to PBIS in our school building. So if that's something that you're interested in, you can always follow up with an email to me or just let your classroom teacher know, like, hey, I might want to, join that PBIS group and they can get me your information. We do also have coaching. So we do coach our classroom teachers on PBIS as well. If at any time throughout the presentation, if you have questions, please just shoot the question into the chat. And then Angela, if something comes up, just let me know. So we are gonna start, the big purpose of today's meeting is to talk about challenging behavior and kind of understanding challenging behavior. So we're gonna start with a little bit of perspective taking. So I'm gonna read this for you. You can follow along if you want. So we're talking about Angelo. So Angelo is home playing with his blocks while mom cooks dinner. Mom says, Angelo, dinner is ready. Come to the table. Angelo comes to the table. After a few minutes, gets up, grabs his sandwich, and goes over to play with his blocks. Mom says, Angelo, come back to the table. Angelo comes to the table, drinks some juice, and then leaves again. Mom tells Angelo again to come back to the table and starts to guide him back. Angelo throws his sandwich and then falls on the floor, kicking and screaming. So I don't know about you guys, but it's a scenario that sounds somewhat familiar. My house, mealtime isn't always the easiest. So you can put your answer in the chat or you can unmute. But how do you think mom feels in this scenario? Maybe if you've experienced something similar, or if you can just think about Angelo's mom, like how do you think she's feeling during this scenario? Frustrated. Yes, definitely. Tired. Do moms ever not feel tired? I don't know. I feel tired frequently. But yeah, frustrated, tired, maybe upset, right? Thanks, Julia. Always tired here too. Maybe angry a little bit. I definitely feel a lot of emotions when I sometimes I work all day, I come home, cook dinner. I'm like, I want to have this like lovely family dinner, and then scenario similar to this happens. You can have a lot of emotions around it, right? Now, what about Angelo? How do you think Angelo is feeling in this situation? What do you guys think? Mom's upset. Angelo's going back and forth to the table. Mom's trying to guide him, direct him. He ends up on the floor. How is Angelo feeling? Maybe similar to mom. Julia said upset because he really wants to play with the blocks rather than sitting at the table. Yeah, right? He's clearly showing, right? He does not want to be at the table with mom, right? And that he wants to be, with his toys, right? So I'm sure mom and Angelo are both having a lot of big feelings at the moment, right? So I always think it's good to look at perspective, right? With any sort of conflict, whether it's, between a parent and child or not, right? Like what is the other person feeling? It's important to see that sometimes we all bring big emotions to the table, and we're going to frame that a little bit more as we move along. Oh, sorry. So I just touched on this a little bit. I'm just gonna hide my controls here. But Angela was communicating something, right? Challenging behavior, especially when displayed by young children, communicates something, right? They're trying to get a message across. Sometimes young kids might not be able to express their emotions effectively. Some kids might not even have developmentally appropriate language skills, right? Which is another layer component to this, right? So behavior can communicate a message when a child doesn't have the language to communicate how they're feeling, okay? Instead of language, behavior can be used by a child who has limited social skills, right? Or has learned what the challenging behavior will result in getting their needs met, right? So maybe a child doesn't have the language skills, maybe they don't have the social skills, right? Or maybe it's just a learned response, right? That, oh, I do this, I cry, I hit, I throw, whatever the behavior might look like, and then they get their needs met, right? If you think about infants, right, and toddlers, right, at those developmental stages, right, babies cry, we meet their needs, right? We bring them bottles, we change their diapers, we pick them up, or we put them to sleep, or we try to meet their needs. And as kids grow and develop, we expect them to also develop, their language skills. And sometimes that doesn't always happen, right? As far as those age appropriate expectations. And honestly, expressing feelings is even harder, right? Than just typical language development of saying what they want and what they need, right? So even if a child has some language saying, that makes me feel angry, or I'm sad, right? It's even harder. It's even harder for some adults to do, right? To express their feelings. Young children also engage in challenging behavior because it works, okay? So what that means is that the behavior results in them getting access to something or someone, or avoiding something or someone, right? So we're gonna talk about that a little bit more as we go through some of these slides, but think about that, like we said, young, babies cry, get their needs met. As kids grow, even if they have typical development, this is not specific to children with special needs. This is just basic, behavior that if a behavior that we do gives us the outcome that we want, we're gonna keep engaging in that behavior, right? So the same goes for young kids. And sometimes, we'll talk about that in a little bit, the outcome that they want, right? We might even be giving them not even knowing it. So this is all just some basic behavior analysis, okay? So behavior analysts, when they try to figure out why behaviors are occurring, look at what comes before and what comes after the behavior of concern. So we call this the ABCs of behavior, because the fancy behavior analytic term for the before is an antecedent, right? It's an event, an action, or a circumstance that happens before the challenging behavior, okay? So an example might be, let's say, it's time to clean up, right? So if I'm at home, I'm like, all right, kids, time to clean up. That's the antecedent, right? I gave a direction, time to clean up. Now the behavior, the B, is anything a person does, okay? When we refer to challenging behaviors, when we're referring to those behaviors that interfere or that aren't appropriate responses, right? So if I'm at home and I say, it's time to clean up, and then my kid runs in the corner away from me, right? What was her consequence? The C. C is our consequence. What happens after? So I say time to clean up. The behavior is she runs away. What is the consequence? Okay, what happens, right? What is the action or response that a child receives from others or their environment immediately after the behavior, right? Do brother and I just clean up the toys without her, right? Or do I go over and try to have her help us, right? So if mom and dad, and sometimes it happens, or older brother and sister clean up, right? That means that my little daughter just successfully got the outcome she was seeking, right? Which was she ran away. She probably didn't want to clean up. So what that means is that next time that same antecedent happens where mommy says, time to clean up, right? The same behavior is probably going to happen because she got the outcome that she wanted last time. So she's probably going to run away and expect that she's not going to have to clean up, right? So we're going to talk about more examples like this as we go through, but it's really important to just think about this framework. And it's hard to do it in the moment, right? But sometimes it's good to reflect, right, on challenges that are occurring, especially patterns, right? If you're seeing the same sort of challenges happening at home, to try to use this framework to say, what's happening before, what's happening after? And can I change any of those, circumstances or environments, right? Any questions before we go on? We're going to talk more about this, but any questions right off the bat? Okay. So we do a little practice. We're going to go back to Angelo. Remember, we talked about Angelo. His mom told him it's time for dinner. We're starting at the end. She guides him back to sit to his chair. He throws that sandwich. He falls to the floor. He's kicking and screaming, shouting no. Mama says, stop, tries to pick him up. He kicks her, and she sends him to his room. So that was the ending of Angelo. Not so happy ending to that scenario. But we're going to break down the A, B, C, the three components of this scenario. Okay. So first, we're going to look at the antecedent. So what is the antecedent to this situation? What comes first? What is the environment or the direction? What happens before the behavior? You guys can unmute or put it in the chat. What do you guys think is the antecedent to Angelo's behavior? So, and we can go backwards too. Like if we think, well, what is the behavior? There's many challenging behaviors in this scenario, right? So what happens, right? What does mom say or do before that behavior occurs? Okay. So if we're looking at this passage, the before is going to be that his mom tells him it's time for dinner and she guides him to his chair, right? So that's the antecedent. So time for dinner, mom says time for dinner, and she starts to guide him to his chair. So we're going to now look at the behavior. So what is the behavior going to look like? Okay, so for Angelo, right, this is, we're going to look at, because you actually could pick out some different pieces of behavior in this, but we're going to focus on, after mom guides him back to the table, tells him it's time for dinner, he throws that sandwich, falls to the floor, and starts kicking and screaming and says no. Okay, so we have our antecedent, we have our behavior, what he did, and now we're going to look at the consequence. Oh, sorry, that was supposed to be underlined there. And then we look at the consequence. Okay, so let's see. Thank you, Julia. I think I have a little bit of a delay, but yes, that antecedent was time to stop playing and sit at the table. So the behavior we talked about was throwing the sandwich, falling to the floor, kicking and screaming, and then the consequence is the last part of this, right? Right, it's that after the behavior, mom tells him to stop. It's like a going on its own here, and that's on its own. Mom tells Angelo to stop. She tries to pick him up. He kicks her, and she sends him to his room. So there's a lot of different components here. We could, break it down even further, but ultimately, Angelo goes to his room, right? So the antecedent was time for dinner. The behavior, Angelo was, throwing a sandwich, kicking and screaming, saying no, and the consequence was mom sends him to his room. Okay, so we're gonna come back to Angelo again. Okay, but we are gonna now talk about functions of behavior. Okay, so I do have these little pictures, a little funny little sayings that talk about some of the functions of behavior. So this one I actually had posted in my old office. It said it's all fun and games until someone figures out the function of your behavior, right? So, like we said, challenging behavior works for young kids, okay? But once we can identify why it's happening, right, then we can do two things, right? We can avoid making our behavior kind of facilitate their behavior in continuing, right? And we can teach them a way to get their needs met more appropriately, right? So that's what we're going to focus on, right? We call it replacement behavior, or how do we help to teach them get their needs met appropriately, but how do we also, stop the cycle of the challenging behavior continuing, right? It's kind of twofold. So we're going to jump into these functions or why behaviors occur. So there's 4 common functions that we're going to talk about. And one way to remember them is everybody eats. So escape, attention, tangible, and sensory, okay, are the 4 major functions of behavior. Now, it's important to note before we get started that sometimes behaviors have multiple functions, right? It's not always cut and dry, okay? Helping us, it's important to use our ABC analysis to help us, kind of determine why we think the behaviors are occurring, but sometimes it might be for multiple reasons, okay? So it's good to just preface this discussion by saying that. Also, it's important to note that, I might give some examples as we go through the common functions, but that every scenario is different, right? Every antecedent is different. Every child is different. So even though the example that I give might commonly be correct, it might be different for your child or your context, right? So we always have to kind of keep that in the back of our mind. That it's not like a one size fits all when it comes to function. So first, we're going to talk about escape. Okay, so these are escape, maintain behaviors. Sometimes kids engage in behavior to not have to do what you ask them to do, right? Either to avoid what you ask them to do or delay what you ask them to do, right? So the funny meme here is this little boy whispering, if you're given a task you don't want to do, just start crying. They'll send you straight to the thinking chair. It's like a vacation from work. So I put this on here because I think this is a good part of our the material to talk about, timeouts. And, we don't use timeouts at Easter Seals. And part of the reason is because timeouts are very rarely effective. One of the reasons they're rarely effective is because sometimes kids engage in challenging behavior, okay, to get away from what's happening, to avoid participating, right? So if you put a child in timeout, let's say for calling out at school or at home for hitting a brother or sister, or for throwing toys all around, right? There's a chance that behavior, they actually engage in that behavior because they didn't want to do what you asked them to do. So by putting them in timeout, you're actually still letting them avoid the initial task or demand, right? So oftentimes, kids want to be, they would prefer to not engage in the task. So by putting them in timeout, you're allowing them to escape the behavior, okay? So again, it's not the same scenario for everybody, but there is a lot of research on that topic as far as, effectiveness of timeout, right? As a side note, in preschool, there's kind of twofold reasons why timeout isn't effective. That's one of them. The other one is a piece of timeout, it's punishment procedure. We don't do punishment procedures at Easter Seals, but it's part of PBIS as well. But part of timeout is, withdrawing a child from the attention of the group. And oftentimes timeout does just the opposite, right? Now it puts a kind of spotlight on that child, right? And gives them kind of more attention. So side note, but we're focusing on escape. So escape, maintain behaviors. Some of these are very clear. Sometimes a kid will just run away, right? Or a child will drop to the ground, right? And it's kind of clear that they're trying to avoid what you're asking them to do, right? Escape doesn't always mean a runaway. That could be one form of escape behavior, but it could be just refusal, right? It could be a kid that puts their head down when you ask them to do something, right? So we'll talk about this at the end too, but I'd like to talk about it within the context of the discussion of the function is like, well, what do you do, right? What do you do if you're reflecting and you're like, okay, it seems like this behavior, this child's communicating to me they don't want to do what I asked them to do, but they have to do it, right? And we don't want to get in these power struggles. So what do you do, right? And I'm going to use my cleanup example, right? So my daughter clearly, and this is a true scenario, does not like to clean up, okay? She would prefer run away, and me and brother are doing it. It gets done. She successfully avoided cleaning up. So how do I prevent the escape, right? How do I prevent this from the behavior from continuing to occur? And how do I stop maintaining that behavior? So one thing we found, and I actually borrowed it from a preschool classroom, which I do frequently for my young child at home, a cleanup song. Okay, I'm sure you guys have all heard a cleanup song, right? Like clean up, everybody, everywhere. Okay, that's one of them. There are a gazillion cleanup songs on YouTube. My daughter, like most kids her age, I guess, loves screens and videos. So we put on the cleanup song, right? I'll put it on our TV downstairs. I'll put cleanup song on, I'll put the video on. I'm like, all right, time to clean up. And I make it fun, right? And I'm like, clean up. And I'm singing, the video's on. And then she does it, right? She'll start cleaning up because it's part of the song. So in that case, I use a preventative strategy, right? Which is what PBIS is really all about, right? How do we prevent, right, that behavior from even occurring, right? So I figured the behavior was for escape. I'm going to try to make the task more fun. I'm going to try to maybe pair it or present it with something that they like, right? Like the video for the cleanup song, right? And then she engaged in the behavior and I gave her some positive feedback for that. So one example of escape behavior and how you can use some prevention strategies to avoid reinforcing those escape maintain behaviors. Okay, so that was our first function. Our second function is attention. Okay, so sometimes kids, people do things for attention, right? So our little cartoon here says, statistically, drooling is only cute for the first 6 months. After that, we'll have to start screaming in public to get any kind of attention. If babies could talk, right? So, like I said earlier, you know, when kids are little, right? They have to use their cries to get what they need, to get their needs met. Okay. As kids get older, they recognize that things that they do get adults' attention, right? So sometimes kids don't discriminate on the attention that they get, right? So if I'm, you know, giving positive praise to my child, like, oh, great job, guys, thanks for cleaning up. You know, to them, that might be the same as mommy saying, Gabriella, get down from there, right? Or, you know what I mean? Like, oh, well, we don't throw toys in the basement, right? So sometimes a child might engage in behavior and our response, our consequence is that like verbal, like correction, right? And sometimes that correction is just what they want, right? They want our attention, right? So that's one example. I always share this example as well. I want to make sure we're staying on time here. When my son, so he's 7 now, when he started preschool, so he was around 3, we would have busy days. I would go to work, I'd drop him off at school, I'd go to work, I'd pick him up from school, then we'd come home, I cooked dinner. And that time my husband was working nights, so he wasn't home. So I would like literally I'd get him, all of our stuff in the house. I'd like put him in the living room, give him some toys, and then I'd start cooking dinner. And he would just start crying, like hysterical. Like he would have like these epic meltdowns. I'm like, what's happening? Like we just got home. I'm trying to cook dinner. And, you know, mommy, behavior analyst, should have figured this out sooner. But it took a couple of days. And I'm like, what is happening? And I'm like, oh, right? Because what do you think I did when he starts crying in the living room? I run out from the kitchen and I'm like, what's the matter, buddy? And I'm like, trying to figure it out. He was clearly didn't see mommy all day, right? And wanted mommy's attention, right? I was in the kitchen, not giving him any attention. And then he would scream and fuss and cry. And I would run out to see what was wrong. So what did I do? What did I do? I acknowledged that. I'm like, oh, crap. I've been reinforcing his behavior. I've been giving him attention for this epic meltdown for the past week. So what do I do now? So same thing. I tried to think prevention. Like how can I prevent this, right? How can I, you know, not have this same patterns happening over and over again? So I started to include him in the cooking, right? I also gave him 5 minutes of mommy time when we got home. Doesn't seem like a lot, you guys, but 5 minutes of one-on-one time can mean the difference of they might not now engage in challenging behavior, right? So I'd give him 5 minutes of mommy time. We'd play whatever he wanted to, whether it was like his cars or dinosaurs or we'd rough house or we'd whatever. He'd get 5 minutes of mommy time and then we would cook. And I would include him which meant at the time, because he was little, he would just bang on pots and pans in the kitchen, right, while I cooked. And I would give him like sporadic little like bits of positive attention while I was trying to cook, right? So again, trying to prevent. We also can think about, that consequence, right? It's really hard once you're in it to not respond to your child's behavior, right? We talk about like limiting attention to challenging behavior, just so that we don't unintentionally, right, give attention to a challenging behavior. So what does that look like too? It might just mean that we try to manage our own emotions, which can be hard. But before we respond to, our child engaging in challenging behavior, be like composing ourselves and then just giving them a general redirection to say like, oh, you know what? We're gonna play with our toys on the floor, not on the coffee table. Like, again, using our PBIS strategies, remind them of the expectations, but not give a lot of attention to the behavior, the challenging behavior that's occurring. Okay, so that is function 2. So we did escape, we did attention. Now we're going to do tangible. Okay, so this means sometimes they engage in challenging behavior to get things, right? So this little kid's face cracks me up. And this says, in the middle of the grocery store, I'll throw the biggest tantrum so that you will have no choice but to give me the candy. And this is, the age-old like kid in the store screams, here, have whatever you want, right? Take this, take it, right? Get stuff, right? They're going to have challenging behavior to get stuff. So I feel like, and that's not much with like COVID, but in the past, if you see a mom in the grocery store or in Target and the kid's crying, like you want to like high five them in solidarity. It's like, I see you. I know what you're doing. You're not giving in. Right. And it's hard. It's so hard. And listen, sometimes we do it. Right. Sometimes we're like, here, take my phone. Right. But just know in the back of your head, like if kid's crying, you can't take it. And you're like, here's your tablet. Here's my phone. Just know that you're reinforcing that behavior. So, I'll give you an example, the Target example. When my son was younger, so he's 7 now, when he was younger and we would go to Target, it was like a fun mommy son shopping. And he would do this. He would scream and cry once he realized there was toys at Target. All he wanted was a toy, right? We had to set an expectation. So what did we do? I would put him in the cart and I would say, okay, listen, bud, as soon as we got to Target, all right, we're gonna keep our voice quiet. We're gonna keep our hands in the cart. And if you're a good boy, before we leave, we'll go get a toy, right? So that might not always be the case for your kid, right? He liked these little like plastic animals, so they were pretty cheap, so I would let him get one. But you can set an expectation and then give them what they want, contingent on the good behavior, right? And instead of having a contingent, on, oh my gosh, they're screaming, crying, I'm embarrassed, take this, right? So try to flip it, right? It's same with the phones. Listen, I know we are in this age of phones, right? And we, have these tools, right, that we want to use. So use it proactively, right? If you know that like you're going to have a hard time, maybe you can say, okay, you can watch videos with headphones while we're at Target, right? But you can have it proactively and just say, okay, you're sitting in the seat or you're walking so nicely, here you go, right? Have it contingent on the good behavior instead of on the challenging behavior. And remember that we can also have them teach them that replacement skill of asking appropriately for what they want. If they want a toy, oh, I want a toy. Or can I have a cake pop down at, Starbucks and Targets? My son asks for cake pops all the time, right? So instead of having the challenging behavior, maybe if they ask appropriately, they can have what they want. They're tangible, right? So think about that. Think about prevention. Think about that replacement behavior, right? So the last thing we're going to talk about before I want to stop recording and give you guys time for questions is another function of behavior is sensory or automatic. So sometimes kids engage in behavior because they like the way their body feels when they engage in that behavior. Okay, so this might be like, sometimes we call it automatic reinforcement. Sometimes we call it like, like sensory stimulation, right? But an example would be like jumping up and down. Okay, why is my kid jumping up and down? Well, they're jumping up and down because they like how their body feels, either when they're jumping up and down or after they're done jumping up and down, right? So we don't necessarily, every behavior that occurs for this reason is not a challenging behavior, right? Some kids with autism, right, have different sorts of mannerisms that they do or engage in that gives them sensory input, right? Maybe they're rocking, okay? Maybe they're flapping their arms. Maybe they're, tapping a table. Even like nervous habits that we have sometimes, tapping a foot, right? We engage in that behavior because the impact it has on us might be calming, right? So it's not always a challenging behavior that has this function, okay? And we don't utilize behavioral interventions for behaviors that are sensory based unless it is like harming a child or interfering with their learning or function. It's really important, right? But sometimes a child might hit their head, right? Maybe on an object or on the floor or with their hand, right? And sometimes they're doing it because of the impact, right? Or sometimes I had a kid that I worked with, and she was super fun, but she was running, like body slamming into other kids. And I worked with an OT. Again, if you have an OT, talk with them if you think that this might be something going on with your child, right? But anyway, she was running into kids, like body slamming them, and she wanted that input, right? The impact, right? So what did we end up doing? We actually ended up just bringing her to the OT gym we had in that building. And we actually had, some like pads, some like crash pads and some different activities that the OT set up for her so she could kind of engage in appropriate activities to give her that input that she needed before, even starting any of the classroom activities. So just some examples of sensory automatic function. So real quick, let's go back to Angelo. What do you think was the function of Angelo's behavior? What do you guys think? Who has any ideas? You can put in the chat. Was it escape, attention, tangible, sensory, or maybe a combination of both or a few? What do you think? Remember Angelo, he was playing with toys. Mom said it was dinner time. He kind of went back and forth between the table. Mom tried to direct him back, and then he had a big meltdown. Mom sent him to his room. What do you think was Angelo, the function of Angelo's behavior? Anyone have an idea? Joanne says escape. I definitely think escape was one of them, right? I definitely think he did not want to be at the table, right? And I was thinking maybe it could be partially tangible too. He did want his toys. So again, it's not always one, it's a combination of both, but I think escape, is probably potentially one that, would fit in this category. And, what could mom do? What could mom do knowing that Angelo is trying to escape the demand of sitting at dinner? I'm going to share an example of a family that I work with at Easter Seals that it was not Angelo, but it was a very Angelo-like scenario. And this mom actually shared in a family group that her son had similar behavior, and she kind of shaped his behavior a little bit. that she let him, he didn't want to sit at the table. So at first he would actually sit under the table and eat dinner. And then she brought him like a little table over next to the big table, and he would sit at that and eat. And then eventually he sat at the big table. So mom kind of set these like different steps of expectations, right? She's like, oh, first my expectation's fine. He can sit on the table, it's fine. He's not engaging in challenging behavior. Then she kind of upped it. It's like, okay, now I'm increasing this expectation, right? It's those like successive approximations to the end goal of sitting at the table, right? And they got there, and eventually this child would sit at the table, right? So, just one way we can try to maybe avoid some of the escape, right? Is try to meet the kid where they're at, and then give them little steps to get to that big goal of what we want the end goal of the behavior to look like, right? Okay. So, talked about this a lot. The function, now what, right? Think about prevention, right? Think about correcting behaviors, or not even correcting behaviors, but think about replacement behaviors and then consequences. Think about the decisions that you're making as far as your response to your child's behavior, right? So, look at that ABC model. Think about the behaviors and think, oh, how can I prevent this? What can I help them to work on? And, how can I change my reaction or my response? And we can always help. We do this in school all the time. We can always help. You got this. Having young kids is hard. Having young kids during a pandemic is even harder. So I'm going to stop recording.